Okay.
So we are having another 40 seconds to start the session. So.
Okay.
Sir, I'm starting the session. So, a very good evening, everyone. I welcome you all to APFSSH and APFSHT and APWA Pre-Congress Webinar Series 2025, organized by ISSH. And now I invite Dr. Rohan sir to welcome the speakers and the moderators. Over to you, sir.
Hi, thanks, Roshan. Good evening to all. My name is Rohan. I'm from Mumbai, and welcome all to the pre-Congress webinar series. This is our webinar number 5, organized under the aegis of ISSH for the Asia Pacific meeting coming up in September 2025. I would like to invite Dr. Pankaj Ahire, President of the Indian Society for Surgery of the Hand, to take over and introduce our esteemed speakers today. Pankaj.
Thank you, Rohan, and good afternoon, viewers. I hope you are keeping safe. It's my pleasant duty to introduce the speakers of this webinar. I think this webinar is like none other that I have seen for a long time. 3 stalwarts of Indian Hand Society and legends in the field of hand surgery are there on one platform. It's a rare occasion. Dr. Mukund Thatte, based in Mumbai, has done pioneering work in birth brachial plexus palsy as well as congenital hand problems. And he's going to talk to us today about his philosophy of radial dysplasia and how it differs from the rest of the world. This talk will be followed by Dr. Sridhar. We have heard him on many occasions about the tendon imbalances in the hand. And I have rarely seen anybody speak of mechanics of the hand like an engineer, like he does. But today he is going to speak on not so technical aspect about the world that has built him. And then he will be followed by my mentor, Dr. S. Raja Sabapathy. It won't be an exaggeration if we call him the international face of Indian hand surgery. He has taken hand surgery from India to global levels. And he is going to speak to us about lessons that he has learned from conferences. I think a webinar is a perfect platform to tell people why we need to still attend conferences in person. So it will be a fitting closure to this webinar. And now I welcome Dr. Mukund Thatte to tell us about his philosophy of radial dysplasia.
Thank you, Mr. President. Thank you, Rohan, and greetings to my fellow speakers. I will start sharing the screen. Is it shared?
So your PPT is not visible. So.
Okay. Now?
No, sir.
No?
No, sir.
Now?
Yes, sir. So please put it in full screen mode.
Yeah, is it visible?
Yes, sir, it's visible, sir.
Okay. Sorry about that glitch. It always happens with the share screen. So my brief talk is about radial dysplasia, the history, my preferred method, and the philosophy behind it. So let's start with radial dysplasia, also used to be called radial club hand. One of the commonest cases in our outpatient department. And historically, these three people, Saint-Hilaire, Lebu, and Polelon, I can't do the French pronunciations properly, described it in the 19th century. The first gentleman called it vices of conformation. The second, for the first time, added the fact that it was a longitudinal defect. And the third gentleman added the radial ulnar aspects of it. To go back to embryology, the limb territories are determined by the right positions along the cephalocaudal axis, and the limb bud grows out of the flanks of mesenchymal cell masses covered by ectoderm. The position, number, and identity of the limbs depends on the expression of Hox genes. And there are molecular level 3 signaling centers: proximodistal, anteroposterior, and dorsoventral. When we say anteroposterior, we actually mean radial ulnar. And proximodistal is proximodistal, dorsoventral is nail on one side and skin on the other side. So the apical ectodermal ridge controls the proximodistal development. The zone of polarizing activity, also called ZPA, does the radial ulnar, and the non-ridge ectoderm in between W and T is for the dorsoventral. And cells within these centers govern the process of differentiation. So reduction in fibroblast growth factor is associated with AER deformities. There is loss of tissue volume, but the ulnar-sided expression is intact, and it shows that the sonic hedgehog still works. Radial-sided deficiency is variable and progressive, and that is what we are going to talk about today. It can vary from just the thumb to affection of the carpus to radius to humerus and in general to all soft tissues on the radial side. The only known teratogen is busulfan, which is an anti-malignancy drug, given to pregnant mice at a certain stage, 9 to 11.5 days, has a similar effect. This is the standard classification. Type 1 is the short distal part of radius. Type 2 is a hypoplastic radius. Type 3 radius is partially absent, and type 4 is radius is completely absent. Our treatment and philosophy is mainly on discussions of type 3 and type 4. As you can see here, type 1 is typically treated only with a tendon transfer, and type 2 with distraction lengthening. Type 3 and type 4 require formal surgery of RCH, which is what we will talk of today. And this is the modified classification. Instead of reading this busy slide, I will show you the pictures from Manskay's landmark paper of 1999. I attribute the pictures to that paper. This is type N, thumb abnormal, carpus normal, radius normal. Type 0, thumb abnormal, but carpus also abnormal. As you can see here, the scaphoid is missing. Type O, thumb abnormal, radial head dislocation. Then we come to type 1. Radius hypoplastic, in this case, lunotriquetral coalition and proximal radioulnar synostosis. Type 2 radius is hypoplastic both sides. Type 3 no distal radius, and type 4 radius is absent totally. Again, you can see carpal coalitions. This is the incidence of various type in Manskay's paper, and I tend to agree with this. The vast majority requiring treatment are type 4 or the type N or 0 where we typically, or 1, where we typically only do a polycization or a thumb reconstruction. These are the common syndromes associated. We typically operate at 6 months of age before the onset of hand-to-mouth reflex, so that by the time we finish with polycization, the child is still young enough to use the new thumb properly. Good elbow function is a prerequisite. If the elbow is stiff, as it sometimes is, then we do not treat the radial club hand. These are the goals of treatment that we look for. Although while I was studying for this PowerPoint, I came across a paper by Mary Beth Ezaki from 2021, where she has challenged the whole idea of treating a radial club hand, and she wonders if leaving them only with a soft tissue correction without any distraction or refixation is perhaps smarter than what we have been doing. But we basically want to centralize or radialize the carpus and obtain a functional stable wrist. Now, this whole thing about centralization and radialization is, I think, over-discussed. We basically want to move the ulna. And in my opinion, if we radialize it, then as it always tends to recur a little, then by the time the recurrence is happening, it centralizes. If we only centralize it, then it will recur with going back to the ulnar side. So I want to discuss the limitation of the conventional approach, which one of the pioneers was Lamb, and this is reproduced from a paper by Lamb et al. They discussed that you need to excise the carpus, create a notch, and then fit the growing ulna into that notch, which means they are further shortening an already deformed limb. And then plenty of long-term studies have been done, as I will show you, which show that this approach leads to severe shortening in the limbs. As it is, Henkel's paper shows that even with no treatment, the limbs reach 65 to 70% of growth compared to the opposite side. So in the conventional approach, there are skin shortages leading to wound problems. And again, in the conventional incision, discarding good skin on the ulnar side, quite an unnecessary step was done and recurrence was common. So now I come to our philosophy. We have two stages in this philosophy, which we have once published twice, once a 5-year follow-up and once a very long-term follow-up. So basically, we use a biplanar mini X-fix cum distractor, distract the hand and carpus away from the lower end of ulna, and hold the distracted position for 2 to 3 weeks for relaxing the ligamentous structures. The idea is, in an untreated hand, the ulna is typically overriding the carpus and therefore cannot be moved to either centralize or radialize. So unless you distract it, you have to then do a notch if you want to really put it in the correct place. And in the stage 2, we do a formal radialization with a Evans bilobe flap along with a Bugramko type of tendon transfer, which means we are using knowledge from multiple people to develop this method, which is always the case in medicine. We always stand on the shoulders of others to see further out. This is an example of what we do pre-op. This is a mini external fixator. And this is towards the end of the distraction. The rationale, as I said, is the carpus is almost invariably overriding the ulna. And the distal end of ulna is therefore distal to the proximal part of carpus. And without distraction, it will not allow the ulna to be moved. It also causes tissue lengthening and histiogenesis in a new dimension, and therefore allows very smooth relocation without stress. Most important, there is no disturbance to any growth center, and therefore we believe that good growth is allowed. The bilobe flap described by Evans et al. Allows 360 degrees exposure. It rationally uses ulnar-sided excess to be transferred to the radial side, and the closure of the ulnar side of the bilobe flap adds an additional vector in the right dimension away from the tilt. So an example, fully distracted, and then we mark this bilobe flap. So one flap is on the ulnar axis, one flap is dorsum of the hand, and on the radial side, we take a transverse incision. We first expose the radial side and release everything. If there is a fibrous anlage, we excise it. We are careful to keep the median nerve. And we look for radial-sided wrist flexors and extensors, which is what Bugramko described. Honestly, in my experience, we find them very, very rarely. And therefore, the Bugramko type of tendon transfer in a type 4 is very, very rarely possible. As you can note, when we take the dorsal flap, we preserve this vein so that when we do a policization, we do not have problems. And once everything is done, we expose the ulnar carpal joint. And as you can see, the ulna is moving freely. It is distracted and therefore it can be moved to whichever position we want, to radialize, to centralize, etc., etc. The X-ray here shows that we have radialized it. And that's the clinical picture. And then we do a closure. As you can see, this closure on the ulnar side adds a further tilt, which aids the vector for the movement that we have wanted. And this is how it looks after good healing. Post-operatively, we keep the K-wire for 4 to 6 weeks, then put the patient in a POP cast to continue the corrected position with wire removal another 4 to 6 weeks. And we follow that up with a molded thermoplastic splint till the age of skeletal maturity. This was told to me by Professor Wilkie during the APFSSH in Chennai in 1999. I had presented my early results with this technique and he asked me, young man, how long do you splint them? So rather casually, I said 2, 3, 4 years, sir. And he said, no, you have to splint them till they're 18. And I took it to heart and ever since then I have splinted them till they're 18 if they will listen to me. This is our latest paper where there is average of 13 years but up to 20 years follow-up of these same cases. And I want to show you this picture where in the beginning is our study followed by Wilkie, who spoke of doing a vascularized metatarsophalangeal joint transfer. Then Manske, Lamb, Bora et al. And Sestero et al. If you see, apart from Wilkie, everybody else is around 50% length of the opposite ulna, while we and Wilkie are at 69 and 67%. So we believe that this method of ours, without involving the complex microsurgery of Professor Wilkie, gives excellent results long-term in terms of growth. An example of a 7-year-old female, a child playing karate after having a radial club hand corrected and polycization done. And the same child as a 20-year-old man, 67% of contralateral side, he has started his first job. So consistently, the growth rate has been maintained. Interestingly, while we were writing this paper, we had some bilateral cases. And the reviewers asked us, how did you decide on the bilaterals? And my co-author in the paper, Dr. Bipin Gangurde, did a tiny study in Wadia Hospital and we did measurements on 30 normal children who had come for something else. And we used that as the normal. In fact, that problem was one of the reasons why, as President ISSH, I instituted the Indian Normative Data Study. We now have a paper with 1600 ulnas measured all over India, and therefore anybody in future can refer to the standard lengths at every age from 1 to 18. Why my method? It is physiologically non-destructive. It allows tissue expansion before radialization. It's a tension-free repair. And the long-term results which I just showed you justify the hypothesis. I thank the APFSSH committee and the audience for patient listening. Thank you.
Thank you, sir.
Thank you, Dr. Thatte. As of now, we don't have any questions coming in on the chat box. We'll wait for a few minutes.
Okay.
In the meanwhile,
Sir, may I ask the question?
Yeah.
Yes, of course.
I've never operated on a radial club hand. So that's a disclaimer about my ignorance. However, one of the common things that we heard during our early training period was a radial club hand correction was, the surgical corrections were always for cosmesis and much less for function.
Mm-hmm.
What's your argument against this?
Yeah, so this is one of the points Mary Beth Ezaki has made in the 2021 paper. But she also agrees that trying to put the hand straight, if the elbow is functioning, and doing a polycization at the right time, definitely changes the function. Definitely. So whether you will do complex joint maneuvers or not, which I also don't do, the soft tissue correction is very much worthwhile.
And what happens when an adult beyond 18 years of age presents to you with an untreated radial club hand? Do you look at these hands differently than from a child?
So typically they don't want it, and I have an example next to my house. There is a panwala next to my house who's 40 years old, who has an untreated radial club hand, no polycization either. I see him tending to his shop. I also see his difficulties, although he has managed to work quite well, but he uses chopstick for everything. He doesn't have a polycization. So once while chatting to him, I offered him that, can I do your polycization? Forget the radial club hand. And he said, I wish somebody had told this to me when I was a child. Now let me think if I want this at the age of 40. So he was willing for the polycization. The radial club hand, it's a little too late for that. He's 40 years old.
But you are in sync with the idea of polycization in an adult.
Yes, I am.
Okay.
Yes, I am. If the adult is wanting it, I wouldn't push it on him. I would offer it to him, show him pictures, show him functional videos, and then ask.
Sure. Do other speakers have any questions for Dr. Thatte?
No, Pankaj.
If not, I'm sure Dr. Thatte will come back to you.
Thank you.
Towards the
Pankaj.
end of the session with more questions.
Pankaj, can I ask one
Yes.
question?
Sure, Rohan.
Since this talk was about history and philosophy, Dr. Thatte, when you reach the idea of a biplanar fixator after going through a uniplanar fixator, or
Yes.
this is something that you directly started off?
No, first 2-3 cases we did uniplanar and realized it was inappropriate because we wanted to do the two sides differently, and then quickly shifted to biplanar.
Okay. And I'm trying to, my next question, I'm trying to correlate it to the adult distraction. So when we try to reduce a distal radius and distract it with a distractor, we end up having a lot of stiffness in the wrist or some issues with the growth epiphyseal plates, the physeal plates if it's a child. Has that been an issue when you have distracted the...
So as you see, our long-term results of almost 20 years show that we are hitting 67% of the opposite ulna, which is the same as what Heikel has shown in untreated patients. So we are reaching the full potential of growth.
Okay. All right. Thank you.
Thank you.
Pankaj, no more questions as said on the chat box. We can go with Sridhar, sir.
Dr. Sridhar will now present to us about the world that shaped him. Dr. Sridhar?
Thank you, Pankaj, Mohan, Habbu, and Pankaj, and my dear friends. Can you hear me?
Yes, sir.
Yes, sir, we can.
Okay. No, I think my talk is more about non-technical aspect, the world that built me. When I say world is not just geography. It is the culture, the people, the place, the opportunity, the events. Even events which are not in your control, all shape a person's life. You can see here the three different phases of Sridhar, who joined in 1966, the medical college, and went through up to 2025, almost like a green leaf turning yellow, and now it is...
Sir, we can't see your PowerPoint.
Can't?
No, sir. So please share your screen, sir.
Why, I shared it.
No,
Can you?
sir. Sir, you can minimize the screen and open it. Yes, sir. So please put it in full screen mode.
Can you see now?
Yes, sir.
Okay. Then I'll start off. So the world that built me, when I say world is not just geography. It is more the culture, the people, the place, the opportunity, and even the events totally unconnected with me, which has influenced or changed me. I joined medicine at the age of 1966. Sorry, in 1966 when I was 17-year-old. And now through the yellowish leaf, I have now become almost a dry leaf, as if the leaf of a fall. But I call this a golden period of my life because each leaf a reminder that every season brings new growth and new beginning. I started with ether anesthesia and tube pericle, then switched over to microvascular, then now even computer-assisted surgery and custom prostheses. I have been a witness to revolution and I have been an early adopter, and I'm very happy to see that I am part of this revolution. I am not seeing it from outside. The family and the environment, I was born just a year and a half after the independence struggle, and a couple of my own family members were freedom fighters, and all of them were highly educated people, not only in English and modern, but also in the native languages and Sanskrit. And they were all more orthodox. So nationalism, value-based life, and culture have been there right from my formative ages. I was born within a year and a half of free. Now, a couple of months just before I was born, my father had a stroke, and he was an aphasic and he was a hemiplegic, and I lost him when I was just 15 turned 16. And I was brought up by my mother in the family. She taught me how to face the world. If I can give you an example of an anecdote, we were traveling in a train to Bombay. At that time, there were no vestibules in the train. And I got down in one of the stations. She asked me to buy milk. By the time I got the milk and I was about to come to the compartment, the guard whistled and it was about to move. So I got into the nearest compartment. And it was 1 hour before the next station came, and I got down and went back. And I could see my mother coolly sitting in her seat reading a novel. I asked her as a child, "Were you not perturbed?" She said, "I think I have more confidence in you rather than confidence you have in yourself." So that is the way she brought me up. And many people other than her, one of them to say is M. Srinivasan, who has been my general surgery teacher, and he was a fantastic clinician. His clinics were the most to look forward to. He will take us through an interesting journey of clinical examination with twists and turns, and invariably we will end up with a point of no return, having committed harakiri on the way. He will laugh at the end and say, "You are all like lemmings." A man with great knowledge and wisdom. He will take us through the myth of lemmings committing mass suicides and say that you are like those rodents jumping off the cliff and committing suicide. He has so great general knowledge. As through the clinics, we used to listen to him of various facts of life. In the year 1979, where there was ISSH meeting, I was fortunate to listen to H. Srinivasan. He made me think differently. He was talking on internal stabilization of the thumb, the dynamics, his reasoning, elucidation of the functional morphology actually transported me to a different world of logic and deduction. That day, he became a role model to me and influenced the way I look at a problem. But paradoxically, he was against the concept of role model and guru. He used to say, "It is like a tunnel. You may see light at the end of the tunnel, but it is going to be a tubular vision. And you can never think independently." So he was dead against calling a person role model. He used to say that I am doing it so because my chief told me to so. So that is something which blocks your thought processes. And he also used to tell that scientific work is like an artist You can see the artist may paint a picture out of sheer happiness for themselves. But once the art is completed, it no more belongs to the maker alone. Unless and until others appreciate that, it has no value. He said, the science is even truer than this art. For scientific work not validated by others, it is like a soul in limbo. Of course, most of you know what is Schrodinger's cat, which used to have things which will kill it. But unless and until you verify whether the cat is dead or not, the cat is supposed to be both living and dead. The same way, if your scientific paper is not validated by others, it is as good as not getting the validation at all. The places that have had a lasting impact in life is the next one I would like to touch upon. From passing out of a Tamil medium school, not fluent in conversational English, I landed in Kasturba Medical College and saw in awe a different world altogether of cosmopolitan society from various parts of India and abroad, a melting pot of various cultures. It modified my orthodox, conservative upbringing to view the world in a broader perspective. Learn to accept alternate ideas, alternate views, alternate perspectives. I learned all my life's lesson. It is an unforgettable place that shaped most of my perspectives on life. Then came Stanley Medical College, the Karma Bhumi, I must call it as, to run an organization, man management, utilizing each individual to his maximum capability for achieving the common goal. There is no other place than the plastic surgery department of Stanley Medical College. I would like to compare RV to Lee Kuan Yew. There is always a way to do things, and you may say the only way in a place where many work. No other way to do it. It is an idea of protocol was born long back there. In our country, he used to say, no instruction board or red line can stop a person from crossing. You need physical barrier. So everywhere you could see that he would have constructed a barrier and not a line saying, don't cross this place. You can see the typical example. In the reception of the hand injury surveys, he would have tied the chair to the table so that nobody moves the chair for going and having their lunch or trying to change the bulb of a lamp. And when the patient comes, there will not be any chair to sit. So you could see here how physically you must work and then change it, adapt it to our situation rather than just follow the Western model. Next place which changed me was the National University of Singapore. In 1989, I was there with Robert Foe, and then in this same lab, I trained in microvascular surgery. You could see here the technician, an excellent microvascular anastomotic technician he was. So he used to help me, and then he was the one, I must say, that who taught me how to do microvascular anastomosis. One of the common events, I must say, or the opportunity I had was to work in leprosy. One of my classmates in an alumni meet met me and said that he is part of a leprosy project about 300 kilometers away from Chennai. And he said there are no reconstructive surgeons there and he has many cases to do. So I joined him. It is at Shakti Nagar. I was able to see and operate upon the leprosy patients. I used to visit right from 1991 up to 2002, every 6 weeks, I used to travel from Chennai to Erode and Saktinagar by jeep and then perform the surgeries there. That gave me an excellent opportunity in coming to know about the various tendon balances, and I could apply my knowledge gained from H. Srinivasan and Dr. Palande to those patients. There was born the extensor indices procedure and also the modification of Gildes procedure for leg of Thomas. I had an opportunity to meet the Shankaracharya in a medical care, and he was the one who told me, why don't you start a charitable medical trust? In the year 1985, we started a charitable medical trust, and we used to run it for the slum dwellers. And I did polio vaccination and other vaccination much before Polio Plus was started. And from 21st March 1985 till 2024, we could touch the lives of more than 8 lakh patients. The Sri Lankan Civil War. 1983 to 1991, when our Prime Minister was assassinated, they used to diffuse into Chennai for the treatment, which was officially allowed. It so happened that my charges were comparatively less, and the quality treatment they could get, all of them started percolating towards my private practice. And that is the time, on an average, I used to do every week at least 2 or 3 cases of brachial plexus injuries and post-traumatic complication of both maxillofacial and also hand injuries, which gave me a wealth of experiences. 9/11 came and APSICON 2001 in Ahmedabad came almost the same time. Because of that, most of the international faculty who has to conduct the craniofacial workshop could not come. So as a last minute replacement, I joined the team and I was part of the craniofacial workshop when, to my surprise of all my friends, they realized that I had switched over partly from microvascular and hand surgery into craniofacial, which gave me also impetus to stand for the president post, thanks to Mukund Thatte and Rajiv Ahuja, who convinced me to stand for the election, and I got elected as the president. Now that gave me an opportunity to meet the Honorable Chief Minister. You can see Raja also standing there. He was my secretary at that time for the conference. And we were able to convince her about the amount of work which is being done by plastic surgeons in hand, in burns, and also in congenital defects. So she was good enough to launch a survey of congenital deformities in Tamil Nadu, and 12.8 million children were screened by us. You could see here the statistics, and we made a software to record all those. That was impressed and made me part of the planning commission of the state for the health. Challenges? Yes. When I did the congenital and also was the part of the planning commission, she sent me this patient as a challenge. Bilateral focomelia. I said that I don't think I can do much. She said, whatever you want, you can. Then I said that I can think of something. And this is what I did. I just put a tissue expander, expanded the skin, and then took a flap, and then put a free fibula, fixed it to the scapula, and then wrapped the expanded skin on that. And then on the opposite side, we gave her the left side, I built it. Right side, I have a prosthesis. And moving this thumb, she was able to pick up the object. You can see here. So this was some path-breaking thing, what I could do on that time as a challenge. I got an opportunity from the SRM group to join a team of people to launch this hospital, which is a 450-bedded hospital. I started it off from scratch, and I was part of the team which planned the entire thing, and then we launched it in 2013. That made them nominate me as the Pro Vice Chancellor for the SRM University. And then I was also into the academics of 8 colleges of paramedical and medical and dental. Walking along with me in this path is my wife, Shubha. What I have learned from her, and still I am learning, is the simplicity and joy of giving to others. If you look at her wardrobe, she just has got 10 saris and a couple of North Indian ethnic wear and 1 or 2 Western wear. Anything comes in, something goes out of her wardrobe. I have learned now to minimalistically live, learning from her. These are the people who have modified my life, who have shaped my life. All these were possible just because the world around me shaped me. I have realized I'm just part of this cosmos, one spicule in these galaxies. Everyone had a role to play in shaping me. I played mine, and also I will disappear into the same cosmos from which I came. Adi Shankara's 2 Mahavakyas always I'm fond of. 1, Tattvamasi. That means look inside you, the problems are within you, and the solutions are also within you, and God is nowhere else, He is within yourself. And Aham Brahmasmi, I am part of this universe, and I see God in everybody else. Those 2 sentences, that philosophy carries me along in this journey. Thank you very much, my friends, for giving me this opportunity to elucidate my travel, my journey, and the people who built me. Thank you.
Thank you, Dr. Sridhar. Yeah, it was fun walking your journey with you. To the viewers, Dr. Sridhar has been a pioneer of hand surgery by the ISSH, and he was awarded the APFSSH, the International Federation for Society for Surgeries of the Hand Pioneer Award, at a recently concluded APFSSH meeting in Washington. So his achievements in hand surgeries have been truly recognized all over the world. And I always look forward to listening to his technical talks as much as I enjoyed his talk today. I doubt there will be any questions on this part of your talk, sir, but we will not spare you of the technical questions maybe later. Rohan, are there any questions for Dr. Sridhar?
I'm sure there would be none, because it was fairly inspiring talk. I'm sure inspiring for somebody who's starting out, somebody like me who's probably some years into practice, and also for somebody who's probably into practice for 20-30 years. I had just one question to sir. Thank you for helping us go through your each and every stage. What we realize is at every new stage that you went, the earlier stage was also a part, you took your earlier stage with it. It was not something where you were completely segregated out. So how easy or difficult was it to carry on what you learned from a place A, then to a place B, and to a place C?
It's a slow transformation always, and you are not dropping out entirely the previous one, but you are slowly winding up the previous one to the next. That always happens. When I switched over from general surgery to plastic surgery, that's what I did first. First, I stopped taking malignancy. Next, I stopped taking urology. Third, I stopped taking emergency. And fourth, I stopped everything. So I have not left general surgery straight away. 2 years I practiced general surgery after becoming a plastic surgeon. And one comment only I would like to add to what he said. That is the Pioneer Award. Again, my talk is right. It is not from me, but all others are the one who nominated me. That is the SSI again. So you never walk alone in this world. It's only others who make you what you are today.
Wow.
And another thing I would like to tell, what always Raja tells, is that you take yourself responsible for your deeds, but your deeds must touch others. It must be beyond self, then only you will be appreciated. All famous people have gone beyond self, then only they become famous. You think of anybody, they all would have contributed to others' lives, not their life. Thank you.
I have a question for you, sir. Why and at what stage in their career should a doctor, or let me ask, say a hand surgeon, think of charity?
I started my charity work when I was 35. So I think it goes along with your life. Nothing is charity. I think it's a duty.
But why?
Why? I'm part of this society. I said, I have to give back. When I can, I would like to do that. Not only consider my profession for my own well-being. I think it is for everybody. Raja actually will answer this question much better because he always says that I must think beyond me, first to the association, first to the society. All of them are charity if you go beyond yourself. And then to the society, then to the nation, then to humanity. So each barrier you cross, first beyond you, then beyond your family, then beyond your state, beyond your language, beyond your country, beyond humanity. You have a dog?
Sorry?
Do you have a dog?
I used to have.
Yeah, it's like that. All of us who have a pet know that you are doing it beyond you.
Yeah, the reason this question did come to my mind is on lot of medical fora, unfortunately, because of social media, there are a lot of them, plenty of them. There is kind of an anguish against a lot of government schemes that are running. And one of the common comparisons people want to do is, why does government expect charity from medicos? Do they expect it from IITians? Do they expect it from other professionals? Government always expects charity from doctors. Now, there are two aspects to it. One is government expecting it and you wanting to do something on your own. So
that's the difference. I'm also against that.
Okay.
It must be voluntary. It must be yours. And you feel like sharing it.
Why is it so common among doctors?
Because I think the need for others. I don't think I am going to get my car fixed every day. So a mechanical engineer need not that. But ours, everybody needs that. So we have that with our hands. So we are able to do that.
I'm sure there will be more questions coming on this, and Dr. Raja Sabapathy is itching to talk on this. And it's now my thank you very much. Thank you very much, sir. It was a pleasure listening to your talk.
Thank you.
And now it's my pleasant duty to invite Dr. Raja Sabapathy. I rarely call him that, so I feel very odd when I actually take his name like that. Like I've never taken my parents' name, right? So it feels very odd. Welcome, sir, and tell us, why should we attend conferences?
Yeah. I think, I should thank Nilesh for suddenly calling me one day and said you have to speak on this topic. I just asked him, what's the reason for organizing this conference? Just a question I asked him first. And then he said, we are doing this so that it gives us a prelude to many people to know about this conference coming. And we need to get people to come for the conference. Then I asked him, what you would like to talk? I said, you usually talk on anything. I'll give you a topic of why you should attend conferences or what you will learn from conferences. So that's the reason this topic came into being. So I should start off with one of my mentors, what he taught me when I was in my MS. He told me, I used to ask him, what are the things you attend conferences? And he told me, you must attend every national conference of your specialty. And he said, every national conference of subspecialty of your interest. I think these are a must, he said. And beyond it, if you'd like to go, you should attend one conference where you think you will got a lot to learn. And you must go for conferences where you will teach. So the first two are very important. And the next two, if you are able to do it, it's very nice. So when Nilesh gave me this topic, I thought a lot of younger people will be listening. So the things that really shaped me, I think, as Sridhar said, so this one advice, really shaped me, and I really follow it. One of my habits is, if I consider somebody as a mentor, I just follow him. So I think there is no point in following bits. I think you need to really follow the whole bit. So my scorecard is that when I started attending conferences after coming back from Louisville 91, I attended all the APSA and all the IFSSH conferences. From the early 90s, I started attending at least one international conference in hand and microsurgery. And I never refused invitation to attend local meetings, be it the IMA or Association of Surgeons of India. And because it's told that you need to go to the meeting where I teach. And those are the other meetings or the things where I go to learn. And you must attend your national conferences because it's a show of strength and you also know where the specialty in your country is. So if you ask me which benefited the most, I would say all of them were very helpful, each in one way. And I would say with examples as to how things were. So APFSSH Congress, if you take, it will meet all the criteria because it's an international meeting where you have got a lot of opportunities to learn. And it's our national hand surgery meeting is also being held with it. So you attend our national meeting, one international meeting. And it's also an opportunity to showcase India and support Indian organizers to give a great congress. So I think that's one thing that all the people who are listening to this talk must take it to their heart. If you go to bigger conferences, if you ask me what they taught me, the first thing they taught me was to know my worth and the value of the work that we are doing. I think this is very, very important for meaningful growth. Particularly when I attended the international meetings, I understood as to where I stand and where Ganga is. So it really helped me to understand what was coming in the field and take an early start. For example, brachial plexus surgery was one. We took it off in the 90s. And when everyone said there may not be a great opportunity in this, I think Indians will not be accepting the results that is possible to get in this field. But then I saw that here is a clear field where we have to do. I think we took it on early. And I also understood we really have to have a very comprehensive field in it. So that again help you to understand how to build up a unit. You need to have some orthopedic group, you need to have a microsurgery, you need to have basic tendon surgery. I think everything need to have it. So it really helped me to shape, and it is only these conferences which really helped me to do it. And they also taught me a lesson to hold on to your ideas if you really believe they are good. I think that again is very important because many a time you go and then somebody presents something, or you come back and say, oh, that's great, that's great. But then you really need to sit and think as to what is good for you. I think one of the greatest lessons I heard was in an American meeting when it was in the 90s, when Dr. Fu Chenwei was presenting his talk on toe transfers, partial toe transfers, toe pulp transfers for fingertip defects, speaking. But at that time, it was really very new and raw. And people were taken aback when they saw a toe pulp transfer being done for a thumb defect. So comments were very critical about the procedure, the indications, and the magnitude of the procedure. I think there is a lot of comments, and the comments were continuously coming. Professor Way, I think in the end of it, Professor Way said these words and every comment stopped. The comment that he said was, in my unit, for my patients, in my hands, this gives the best results in the end game. So I think that really had a great influence on me. I said, I think whatever we listen and whatever we see, I think we really have to think what's good for our people, what's good in our hands, and what's good for our patient on our operation table is what is the most important. Because at the time we were going on a very high level of microsurgical advance. So we are the people who started the microsurgery in the region, we are flooded with it. I was doing from tip replants to major replants, and we are doing free flaps. But because of that idea, I didn't let go of pedicle flaps. And we started refining the pedicle flaps to the highest hilt, I think the maximum that is possible. And that I think that was one good thing now that really gave me confidence that not that we need to leave because the world is living there. For example, in some places, there could not have been a better choice. If you see such a big injury and extensively contaminated, after you debride, you need some primary transfers too. And you really need a defect. The defect is much wider in the distally, and you need a defect up to the elbow. I don't think any pedicle flap will give, any free flap will give that such one. And because we had great practice in doing pedicle flaps, I could design a flap which should cover up the whole thing from there to there, and then you find the results that she has got. It is healed without a sinus, and she even in such a bad elbow, she got an elbow. So here again, electrical burns, bilateral electrical burns in multiple defects. So again, so many flaps are needed. So I think it will be very difficult to give it by microsurgery because you don't have any vessels in the mid forearm. And if you have to give a defect you need to have a flap in the area where there are fingers. That means you need to have a pedicle flap. I think nothing short of a pedicle flap will do. We did this, and we did a nerve grafts and all this. And it's the same boy, what you have got. I think what really helps is attending these conferences gave me a confidence. What we need to have is a combination of microsurgery and conventional surgery, what is good. So when you do nerve grafts, you do it with a lot of poise. I think you do it with microsurgery. I think you do that. But then when you have to do the pedicle flaps, that again is good. So by doing large numbers, you refine the steps, extend the boundaries, and get better outcomes, and keep on presenting. So repetition is the mother of skill. You keep doing even when it is not trendy. And then if it serves your patients well, I think we need to do it. I think that's it. We continue to do it. And then from 2000, for every ASSH conference, we are asked to speak about groin flaps. We are asked to speak about posterior interosseous flap when people are thinking it's not a great flap. So because you find it difficult to do that, I think that's one lesson that we got. The next lesson I got was, again from Ravi Kumar, is that whenever you go for a conference, they asked me which conference speeches are good. And he said, if anybody prepares every talk for that particular audience, the talk is good. So that's very important. So for every talk, I always prepare a new talk. And he also taught me how to speak in different meetings. In the first meeting in 1991, he took me to a meeting. He was only invited. I was not invited, but then he took me along to introduce me, stating that a fellow with microsurgery has come. It will be in Coimbatore. So I spoke about so exhaustively about how you replan microsurgery and all that. Then as soon as we got into the car, he told me, "Epa, you should not talk like that. I think for this audience, you only have to talk about finger is cut, finger is joined. That's all. You need to talk only that. You don't need to talk everything." So he said, you must custom design your talks. You have to think of your audience and why you are here. I think what they would like to hear and not what you know. I think that again was the lesson that they learned when attending the conference and speaking in conferences. The other point now I have to tell you is when you speak in the conferences, I think never fudge numbers. I think integrity is very important. Academic integrity is extremely important. And people who matter can see through you. A lot of people can be fooled. But then people who really matter can see through you, can see through the talk and the presentation. It's not really worth it. I'll give you two examples as to experiences. Of course, I can't tell the names. So I was attending a conference in Hyderabad, and I was sitting in a dinner time with a very senior plastic surgeon. And the talk went around about another surgeon who is no more now. At that time, he was alive. He was highly acclaimed, highly decorated. And suddenly the senior surgeon said, I wouldn't believe any word from him. I said, I got shocked. So I asked him why. He said, when I was a resident, I was asked to prepare a talk on hypospadias, our experience. And fistula rate was about 30%. I was asked to fudge the results and put it at 6%. Okay, so he said, but then the incident took place about 40 years ago. I think the memory still lingers. I was just sitting there thinking, as I was taking my dessert, I was thinking that small conference where the numbers were fudged ultimately was not worth it. I think it's not worth it. I think it doesn't happen just in our country, it happens everywhere. I'll give you an international experience. I was discussing about a particular procedure with a very senior Australian surgeon, and he said this of the person who pushed the procedure, and then he said agreed the value of the procedure. He said the procedure is good. He said agree with the procedure. He said but I would take his views with some reservations. He's a very smart person, and he said just give an example. He said both of us were a faculty in Europe, and then flew together to US. As we flew across the Atlantic, the numbers changed. Okay, and he said with a giggle. I think I thought that day, I think no matter what happens and whatever be the stakes, I think it's not worth fudging. I think this is one of the important lessons people have to take. It is not the number of papers or just what you write. I think ultimately somewhere, I think the world will catch up with you. I think the karma, something will catch up with you. I think it's not worth it. And then what makes people believe? I think that again is a very important thing. Speaking to a very senior orthopedic hand surgeon, I think he was very close, a very acclaimed surgeon. He was discussing about the popularity and what makes people accept procedures, or if they listen in a conference, what are the things which will make them go back and do it. I think then he said, I personally think more people will go back and do a procedure which is described by a person they believe to be honest and good than the procedure recommended by the best of the randomized controlled trial. I think he said, I am very absolutely convinced about it. And he said that he is one of the units which do a lot of randomized controls. He is an extraordinarily scientific person. He's recommended as one of the best champions that were in the departments in the whole across the country. He said, while RCTs are very good, the words of a person with undoubted integrity is more valuable. He says that will make the world follow the procedure more swiftly than the most well-conducted RCT. I think that is again which I learned in attending the conferences, because I think these are things which we need to tell our youngsters. I think which really shaped us. I think there's a nice talk on Dr. Sridhar, the world which shaped me. I think these are the words which really shaped me. And the next thing is when you go to a conference, there's a group of people who are doers versus speakers. So once in one of the international meetings, one surgeon from a non-English speaking nation was presenting a paper which has brought a lot of critical comments. At one stage, the speaker responded by replying, have you ever done this? Okay, then he said, oh no, the literature says it's a problem and all that. Then again, another person when the question asked, he again replied, have you ever done this? Okay, so it's so much he asked everybody, he was asking this. When a person asked the next question, the whole audience itself shouted, have you done this? So I think that's the way people responded. So I always find whenever you have a procedure, though one should respect the views of the speakers, a lot of the times, I could always see their value, their reputation, because many people can write papers without having done even the procedure once. So I always take ideas with a pinch of salt, analyze them, and put the reputation of the unit and the surgeon before accepting it as gospel. I think that again is very, very is important. And if you ask people as to why do you go to conferences, they all say networking, and then we meet the legends in the field. That's a very common question, the common answer that we given. But I always like to think, what's the use of being meeting the legends in the field? It's very important is that you need to follow them. Yeah, otherwise, only thing that happens by meeting the legends in the field is the one good photograph you get. Previously, we did not even take the photograph. We just shook hands with them and felt very happy. Now with selfies and all that, we just take a photograph. I think it stops with that. But the excitement and inspiration has to be followed through. I think only then attending conferences become meaningful to us and to the country. I always used to think that if I'm away for 5 days, that means there's a lot of things lost back home. I think I'm not earning. I think the work with the institution has to go on. I think if you're leaving for 5 days or 10 days, you are away, that means you better do some work, when you're wherever you are. I think you need to do some work. Not following through with the excitement that happens or the connect that you get could be costly. I think we lose a lot of opportunities. I'll give you some examples of attending the conferences, getting opportunities and not following through. The WSR of Singapore in the 90s, at the time we are doing a lot of injuries, and one of those injuries was the dyeing industry, where there is a wheel, the hand will go and it will go rotate up to the shoulder. So you'll have a fracture in the humerus, fracture in the forearm, fracture in these things, and avulsion of all the muscles and the vessels in the forearm level, and the distal part will be non-viable. So we titled as monomelic polytrauma to the upper limb. I think this is coined ourselves, and then we presented. It is a huge series. And what we have, I think this is a picture I taken from the abstract book that was there. See, management of upper limb monomelic polytrauma with neurovascular problems. So from Ganga Hospital, Coimbatore, only 2 authors because there are not many people who are working at that time. And Beristos, the editor of the Journal of Microsurgery, at the end of it, I think in the dinner time, I think he called me, met me and said, hey, you only spoke that this morning. I think this is one of the best papers of the meeting. Can you please write it immediately and send it to me for publication? So I'll publish it straight away. But then I never did. And those days, getting it published was a very big deal. But then I was just working, but then I never did. And we lost a great chance of putting our unit on the international scene by 5 years. I should say by 5 years we've done. The only good thing I did was we contacted the units and we put on a guard so that the fellows can't put in the hand. I think as the injuries, just by one single step, I think it's a social cause we did, and those injuries stopped. And experienced Ian Jackson, again, another lost opportunity. It's not that, if you find a lot of people really succeed, but then you'll find for the amount of success they have, I think they have also lost so much of opportunity. A meeting in Coimbatore, one of our registrars presented a long-term satisfaction of groin flaps and outcomes and patient satisfaction. The local flaps in the same limb, like the reverse radial forearm flap, posterior interosseous flap, lateral arm flap. Lateral arm flap was microsurgically. So when people came up for this study, Anil Agarwal, he didn't know Tamil. So he used to group them all and keep them waiting so that he'll take a sister and assess. And people had them to meet, that gave an opportunity for each guys to meet each other and show the results. And then we found that all the people who had skin grafted donor areas in the forearm were so upset on seeing the people with distant pedicle flaps with no donor site defect in the same limb. So all of them came back with so angrily and said, sir, why did you do this to us? That you should have done this. I said, hey, come on, you are hanging the hang attached. I said, that doesn't matter for 3 weeks. You just did it for 3 weeks, but now I got 3 decades of scarring. So we presented this, and Ian Jackson said, Raja, you send me this paper, I'll publish it with color photographs. That's no issue. Those days, if you have to put color photographs, you need to pay extra. I'll put color photographs, no extra charge, because he was the editor of the European Journal of Plastic Surgery. We never did. We never did that, and I regret it again. So if the opportunities open up in the conferences, unless they are followed up, you lose a great. So it's not an opportunity. I think it's only worth a selfie. I think that, and there it stops with that. And sometimes you also have how conferences helped me was in talking to people, and then the comments they give. I think it's been extremely useful. One of that was, again, I go to Ian Jackson. So at the time he was doing editor, he was doing so many things. I just asked him, Ian, how do you manage all this? He said, Raj, it's so simple. He said, you should never hit the bed on the day you wake up. And there's a writer to it. He said, but you have to get up every day early. So which he meant you should sleep after midnight and get up early. And he lived a full life. I think everyone who knows, I think people who are in the faculty here, all of them know this, how he lived his life. So I think that again said you need to work really, really hard, and there's nothing, no other substitute for achieving, what they all achieve. Another thing, I think is off the subject, but then it's again it's a good lot of things you learn when you attend conferences. The early conference, the early 90s, not the early 90s. Professor Sam Sibos used to be the star of all the evening dinners in APFSSH. He dances, he talks, and all that, very stylish. In one conference, I introduced my wife to him. He was quite high on that day, but then still got up to greet her. I told him, sir, you please sit down, sir, you don't have to get up. To which he said in his own style, he said, Sonny, whenever a lady is introduced to you, always get up, even if she is younger. I think he said, I want to teach you this manners to you today. So even today, I just follow it from that very day, and I just follow this. So in a conference, not that you really, and then very many people can teach you so many things. And the last thing, because it's only 15 minutes talk, and I can't pack up too many things. I can really go on for an hour. So the most important thing is conferences could be life-changing for people. I think for me, I should say the most life-changing conference was the IPROS conference in New Delhi in 1986. I was very struggling to go abroad for further training and hitting roadblocks all the time. And it was during this meeting I had the opportunity to get in touch with Mr. Bruce Bailey. I think RV introduced me during one of the tea sessions, and I expressed my wish for further training. And it was just a sort of a few words exchanges, sentences, we spoke each other. And then he said, I was telling yes for everything. What is that you are telling yes for everything? I said, you must be really be keen. I said, I am very, very keen, he said. And somehow I got there, that's it. So I think that was the one which led me, that conference, I think there was opportunity which led me a job in UK. And then on to live. I think I'm ever grateful to Suresh Gupta. I told him to many times to organize the conference, because that was a very life-changing conference for me. And like that, for quite a lot of people, there will be very many unexpected spin-offs of a conference. Even the organizers themselves may not realize. I think when you do this APFS conference, there may be a lot of youngsters who may be meeting people who have been looking for fellowships, and for quite a sum, it may materialize. And it's not that the fellows only the benefit. I think the teachers also benefit. I think if you ask what is the one thing which the heads of departments or the chairmen of departments are looking for, I think the one thing they are looking for is a bright fellow. I think that's what it is. I think they'll give, most of them will give a right hand below their elbow for getting that bright fellow. So these conferences could be life-changing for people, and but we never know. See, I cannot say that if only I meet Bruce Bailey, I'll go to conference. So I went there, and he was there, and it so happened that we met. So I think what we need to do is that we need to really think about it and then to go. So as you move on from attending conferences to organizing conferences, it becomes more exciting. I think the best of organizing conferences is not the 3 or 5 days of the conference that is most exciting, because it just comes and it flies off. You win the bid about a few years ago. You make a committee. You keep meeting people. You have dinners together, late nights. You talk, you do this, and you prepare the program charts. You answer hundreds of emails. But then what really happens is that in the process, you build up a lot of relationships and it is those relationships that you cultivate, the memories that you that you cherish. I think that's what is most exciting. I'm sure there's our APFSSH at Mumbai will also be one such great conference. I'm really looking forward to it. And I'm sure all our people who are listening to this talk and people who will be coming will all have a great time, because our team led by Dr. Pankaj Ahire is doing a great job. Thank you so much, Pankaj, for this meeting. And let's all gather in Mumbai for the APFSSH. Thank you.
Thank you, sir. We so
Recording
much
stopped.
look forward to meeting all of you and the audience. Are we still online?
Recording in progress.
Yes, sir. I think there is some issue. Yes, sir, we are alive.
Yeah. So I'm not sure whether talk, an inspirational talk on meetings will fetch any questions. If there's a technical talk, there are a lot of questions generally. Actually, sir, when I organized a meeting few years ago in Mumbai, it was a lot of work and it took its toll on family time and it took its toll on the practice. And then I said, I'm never going to do this again. And then here I am doing trying to organize another meeting, and as you said, we are enjoying the work, but I'm again starting to think, once this conference is over, for another 5 years I'm not going to do any. So what keeps you going? You organize so many events all through the year. What keeps you going? Does this thought ever cross your mind? Okay, for next 1 year, I'm not going to attend any conference, or I'm not going to organize any conference.
No, I don't know. It doesn't occur to me at all. Once I finish the conference, I always think, when is the next one? Where do we go to the next one, or what do we organize the next conference? What do we organize? Because I'm truly involved in what we are doing, and so I think it shouldn't be. So I really quite love it. And you should also be a person who loves travel. You know? I love the people say, "Oh my God, it's a long flight," you know. But I will always say, "Oh my God, I'm so happy it's a long flight." You know? Because it's a long flight, I really love it because there's nobody to disturb me. Otherwise, most of the time, all other times, somebody's around me all the time. So long flights I really love. That's the time, you know, it allows you to think about yourself. You know, so I think going for conferences is so exciting, and many people feel that when you're alone and when you're working a single line practice and all that, it's so disastrous to go out. But I think it's not that way. And even when we were in 91, 92, when I did not have any assistance, and I always used to feel, I must go to the conferences. So I think that was one of the best things that we ever did. And nothing happens for the 5 days of this thing that you're not there, because you come back and do things better. And so that's the thing. Another thing, what you have to do is when you attend a conference, you must be looking for what's the fault in the conference. So I never look at what's the problem in the conference. I only look at what's good about it, because we don't spend all the money and the time to find out what's the problem there. Okay, you are only going to find what's so funny. If you are keeping having an eye on looking at what's good and not taking about the whole thing into analyzing the whole thing what they did, then it's fine. You don't take it to heart.
Another thing I very distinctly remember you always tell about organizing an event is you must enjoy the process of organizing it. Yes. And you have to make sure that people who are attending the conference are happy at the end of the conference.
Correct.
It is not about sticking your gun to what is right all the time, but I think you should do what makes everybody happy at the end of the day. Yeah. Rohan?
Yeah, so Raja sir,
yes,
I'm asking this question from a standpoint of a young hand surgeon who wants to attend any, say, Asia Pacific meeting. Do I go with an agenda of what to learn at the conference, or do I go with an open mind? So when I attend any conference, I'm always in this doubt. What am I going to learn? What I look at a program and I say, okay, I might attend this, I might attend that. So is it okay to go with an agenda or okay to go with an open mind?
No, if you have got any, because all of us are working, and we might have some problems in our practice. We might have some doubts. I think then to clear that, you need to have an agenda. Okay, these guys are coming. I'll ask them so that it clears your doubts. Rest of things, I think you just go with a very open mind. You have to go to with a very open mind. I think that's which then you really enjoy conference. So many times people start really looking at the program and say, "Oh, what's new?" It's not a question of what's new. it's extremely difficult to do something new every year. No? It's extraordinary. Who can do something new every year? Okay, it's only that some new small things how they present. They're finding out a new spark in a new youngster. I'm always looking for some bright young guy, who's coming up. It's so stimulating to be around these guys. Okay, so I'm looking for some bright spots. So that makes you feel a little bit younger talking to them. Otherwise, what you talk to the same people all the time, it's boring. So you need to have some variety. So I will go with a very open mind. I will go, and I will always like to see all the plenary sessions, attend the plenary sessions. So irrespective whether it's a thing where you have it's your field or something. So I may not be doing high-end aesthetic surgery, but then if I go to a plastic surgery meeting and the top aesthetic surgery guy speaks, I'll be the one who will be sitting on the first row. I think I'll be sitting on the first row and listening.
Okay.
Can I make a comment?
Dr. Thatte had a question. Yes.
Yeah.
No, I don't have a question. I have a comment. I think Raja will like this comment. I have long held a belief, and I want to do a study on this, but I haven't found the material. If I can get the scientific programs of APSICON 86 onwards, because I have attended all from 86, it is my observation that when an interesting foreign faculty comes and introduces a new procedure or new technology in India, within about 5 years, it becomes routine and you see multiple Indian papers on the same subject in a. So this lag period I want to study, because I think this is one of the great advantages of attending conference, that intellectual and technology transfer takes place from outside faculty to our people. So if I could get all the scientific programs, then perhaps I could put a correlation. It's a project I wanted to do for a long time.
Pankaj, one more. We have time.
Sorry?
One more question. So
yes, Shubhu, please go ahead.
So I'm attending a conference and I'm sitting and listening to Dr. Thatte sir or Raja sir or Sridhar sir talking. And once they are done, it's open for questions. And I have a question in my mind, but my hands are sweating, the heart is beating hard. And I fear standing up at the mic and asking our teachers a question. How do I overcome that?
Yeah, but then we have to really tell everybody, there could never be any stupid questions, there could only be stupid answers. Okay? So I think that there could always be, I think to a certain extent, it's also the way your senior people behave. I think when we were young, I think there was a big gap between our teachers and us. And very few people were bold enough to ask. I think it will be extremely difficult. I think Dr. Sridhar will agree that it will take a real lot of courage to speak to RV, Professor RV, because I think the respect really clouded our inquisitiveness to ask questions, barring a few like me, who sometimes used to ask a question. Okay, so but now things have changed. I think the gap between the seniors and juniors have this thing, and most of them are treating their juniors as equals. But the problem comes in the way the questions are framed and all that. My brother used to tell, we had one issue in our institution, I think, where people, I think we tell, see, I can, my brother told the registrar or the younger junior consultant, I think, the moment you become a consultant, I think you are my equal. But then the moment you think you're equal to me, then there's a problem. Okay?
That's a good one.
Okay? See, the problem was, we had a problem. And then a younger fellow just in and all that. We like to treat you as equal, but then the moment you think that you're equal to us, then there's a problem. So similarly, Rohan, I think currently the issue is not, as I would say, people really don't have sweaty palms to ask questions, but they got a robust palms to ask questions, and they ask it in the wrong way.
Okay.
Yeah.
No, that's encouraging for me to stand up and ask a question.
Yeah,
Of course, in a good way, in a non-argumentative way. Makes sense.
Good.
Pankaj, we don't have any questions as yet. So I think because primarily these were a good philosophical talks in regards to how to approach a conference, how to approach your life, and how to approach one particular problem that Dr. Thatte talked about.
Yes.
I think somebody just messaged.
I think this was a wonderful masterclass for.
Okay. Pankaj, 1 second. If I can interrupt, there's one question that's come up by Dr. Isha.
Yeah, how to plan and what to attend the PG.
So the question is how to plan and decide what to attend as a plastic surgery PG. Yes, sir.
Yeah, I'll take that one question. No? But I think, if you're attending for the first time any conference, you'll be bewildered by the number of halls that are there and all that. And don't worry about it. You should attend all the plenary talks. That's number one, irrespective of the specialty and who is speaking. And then half of the time you should attend on things which your department does. Okay, so that you know what your department. And half of the time you should attend on things which your department does not do. Okay, I think that will be my advice to you. Okay, so that you know how to do. I think that's the best thing I could tell for your postgraduate.
Okay. Dr. Thatte, can we go back to you?
Yeah, sure.
Parag had a question. He sent it just after Dr. Sridhar sir started his talk. He asks, if a child comes to you at 2 years, then is it still a distraction first? And second is then how early do you recommend a distraction?
So typically we start distraction at 4 to 5 months. That is how early we recommend it. There are some children, if we have seen at birth, then by giving plasters and stretching every time you give a plaster, you can sometimes avoid a distraction. But for that, you have to really have seen shortly after birth. Now, if a child comes to me at 2 years, undoubtedly, I will distract first before doing it.
Okay.
Question of not distracting.
Okay. I think that's all the questions we had for now. Pankaj?
Thanks, Rohan.
Thank you, everyone.
Thank you, Doctor, for providing us this platform and OrthoTV for streaming it to a few tens of thousands surgeons across the world. Thank you, 3 great speakers and stalwarts of hand surgery, Indian hand surgery. Thank you very much for sparing your time, and I look forward to meeting you in Mumbai. And
sure.
Please stay safe.
Thank you. It was a privilege.
Thank you.
Thank you, sir. Sir, I'm concluding the session, sir.
Yes.
On behalf of Team Doctor, I would like to extend our heartfelt gratitude to all the speakers, to their insightful speech, and the moderators for their extraordinary moderation. A special thanks to Dr. Nilesh, sir, for coordinating the session. I also thanks to all the delegates for joining the session. Thank you, sir. So, with your permission, may I close the session?
Yes, thank you, Sridhar.
Yeah, close, but don't close the meeting, please.
Yes, sure. 1 minute, sir. I'm just...
Recording stopped.
Sir, I would
the meeting.
I would just ask a couple of minutes of all of you.
Yeah.
What's your take on the current situation and about the meeting, APFSS meeting? And I did discuss this with WAMA, and they said we will have a lot of impact on international registrations, and we should expect a few cancellations as well. How should we do we really need to preempt anything here, or just go by the flow?
I don't think I saw your messages, Pankaj. I don't think you need to do anything right now because it's only a few days now. You could stop anytime, or it could escalate. And if it stops anytime now, so I don't think it will escalate. I think that we hope and pray that things stop soon. Okay. So at this stage, we can't do anything. That's the point. No? So yeah. we have got no power to do anything. One, and we don't have enough of information to foresee what's going to happen. So because of that, you just do the same work, same tempo, same speed.
So we stay put on our course of preparation.
Yeah. I think it'll be fine. I think it'll be fine, Pankaj.
Yes. Dr. Thatte, Dr. Sridhar, do you also feel so?
No, I also agree with him, because I think it's September. I think it's
September is fine.
Before that, it should stabilize.
Sir?
We don't have an option. We have to keep quiet right now.
Okay.
If people ask you directly, you say that everything is fine and peaceful in Mumbai.
Yeah.
And that we don't expect anything here.
Yeah.
But apart from that, what can you say? You can't say anything.
Yeah, because last evening we had the first email from South Africa expressing concern about the situation and wondering whether to register or not. So it becomes very difficult to tell people either ways. So that's the reason I thought I should take some input. And we are also holding a EC meeting this evening. We will see what is the opinion of rest of the EC.
Yeah.
Yeah, thank you very much. I just needed some small little inputs before we go.
Go with full gusto. Tell him and everything will be fine.
Sure, sir.
Good.
Thank you, everyone. Thank you.
Thank you so much.
Bye.
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 Thank you, sir.
Sudarshan, you're closing the meeting?
Yes, sir.
All right. Thank you so much.
Thank you,
Thanks,
sir.
Rohan. Bye.
Thank you, sir.